Hey y'all, welcome to another episode of Compliance Capers. It is Betty Hovey with Compliant Healthcare Solutions, along with my colleague and good friend, Sonal Patel of SP Collaborative.
Hey, Betty, how are you doing today? Good to see you.
Good. It's getting a little warmer here, so I'm happy about that. The sun was out all day yesterday. We got it like in the 70s, so I'm not trying to rub it in.
Well, I feel it. Yeah, we're thawing out here, quote unquote. It's like 33 degrees.
Oh,
So it's been a rainy, foggy, weird atmospheric experience here. My 16 inches of snow are slowly defrosting, thawing, and like everything's falling off the rooftop and shattering on the ground. So yeah, it's still cold up here.
I feel for you. I really do. Does that sound like genuine when they said it?
Yeah, I know. It's good to see you in a blouse. I know here I am in my sweater, and yeah, I took off my outdoor scarf, and yeah, it is January in the Midwest. So,
Yeah, that's true. That's true.
It is the season. Yep.
Wow.
Yep.
Well, we are looking today, and the next couple episodes, we're going to take a look. Sonal and I thought it would be a good idea to look at the OIG advisory opinions. And something that I found was really neat because it wasn't something that I was very knowledgeable about. I mean, I would see them as I go on the OIG site, but a lot of times I would just kind of click by it. And I never really, to be honest with you, I never really looked at them. But now that I'm more into consulting and trying to help my clients out, it's something that if you're in a practice, they can be very helpful for the practice to be able to see like, oh, I wonder if what we're doing, is okay, or if we could get in trouble for this. How do we find out without, blabbing to everybody? Well, the advisory opinions is a good way to do that, right, Sonal?
Exactly. No, the advisory opinions are a wonderful tool, like you said, for our consulting work that we do now, right? It's a very, very good place. I know I've posted several advisory opinions that were disclosed this past year that are really quite remarkable in terms of, when practices have the time to read these 8 pages every now and again. It's really, really great nuggets of information of how the process works, what they're looking at, the various criteria, what sorts of federal regulations you could be violating, breaking, disturbing, etc. Right? So they really are looking at your question that you're sending in to the OIG. If you happen to have something that's this large, and I know we want to disclose the details that you and I have found out over the years, right? This really is a process. The OIG advisory opinions are in fact a process, and it does cost you, the practice or the entity or the physician, whoever, it will cost you some funds that you provide to the OIG for them to get this work done for you, to give you their opinion. And so I do think it's rather remarkable when you go back in the, again, OIG.gov website, they do disclose a list of their opinions that they've had over the years. And so, there are various service lines, there's various drugs, there's various information on what you can and can't do for remuneration or not, what you can, give as a kickback. Can you give kickbacks? I think not, but, you can find out more details in these types of advisory opinions that we're going to be talking about on Compliance Capers for the month of February, because we really do think it's not really talked about. And we want to change that here to start having an illuminating conversation on what these documents actually are and how they can help practices.
Yeah, I think that's a really good point. One of the reasons why Sonal and I thought it was a good idea to do these and why we wanted to start these wasn't just to say, oh, look, everybody's doing everything bad here. They're doing bad. They're doing bad. Is to like show people things so that in their own practices, they could make sure they avoid becoming or falling into one of these kind of keeper things that, we talk about.
That's right.
And since we thought that, at least me and, when we talk to our clients and talk to other people in the healthcare field that are into, coding and billing and even auditing, and bring up the advisory opinions, a lot of times either they were kind of familiar or they were not sure what it was. So before we go on and actually highlight a couple of the opinions, we wanted to kind of give everybody the entire background of what it is to get an advisory opinion. Like, what does it mean? What do you have to do? And like Sonal alluded to, it is not for free. So they will give you their opinion, but it will cost you. So we kind of wanted to take the bulk of this session, if not the total episode, depending on, how the time runs, in discussing what that is first, so that moving forward, everybody's got the foundation. And once again, understanding how helpful it is, so that y'all can, go over to the website, the link we just put up, and kind of look through them yourselves and understand the kind of great information you can be getting out of this, and take it back to the administrators and say, we absolutely should not be doing this because, and showing them, or here's one where it shows that they would be favorable and say, yes, it's okay to do that. So it really can help the practice stay out of getting in trouble or being confident in what they're doing, that they're not going to get in trouble, that it's okay to do whatever it is that, idea or plan that they had wanting to put out.
Exactly
So
right.
there is the definition that the OIG puts up, that the HHS OIG issues these advisory opinions about the application of certain fraud and abuse enforcement authorities to the requesting parties' existing or proposed business arrangements. So if you look at the advisory opinions, you will see that they talk about the requestor. So they don't like throw your business out there. So you're not going to see your practice's name or your company's name out there. They will call that person the requestor. So that's what they're talking about here. So you can request of the OIG to give their official opinion about whether something does or does not fly in the face of like anti-kickback and those kinds of things. So that's their official definition.
Exactly. And, just wanted to reinforce what we said in last month's episodes. Another big reason why you and I don't ever talk about names, right? It's just like what the OIG does. Everything that you provide them is redacted, right? So any type of your personal information, your entity, your organization, all of that is redacted from these advisory opinions, which are public, right? Because once they've put the cost, the effort, the time spent on doing the work to issue you a formal advisory opinion, it is disclosed to the public. But again, all of your private details have been redacted. So you don't have to worry about any of that stuff being out in the public. So everybody knows who you are and what you're trying to do. So I think that's a really good point for practices and organizations to not have any additional fear, right? Like, you're actually doing the right thing. You are taking the proactive stance to get as official guidance as you possibly can. And what more official guidance is there than from the OIG, right? So it's a really good thing to think about these advisory opinions as, another tool that you have to use at your disposal, again, to support your your proactive compliance initiatives for 2024.
Yes. And what they are looking when they go through it with the advisory opinions is they're truly looking for things that would kind of buck up against the anti-kickback statutes. That's the biggest thing that they look for in there. And if you go to the website that we again had put up a little bit earlier, they list out the things that they look at. So anything that has to do with like anti-kickback, anything that has to do with safe harbor, which I for the anti-kickback and for people who aren't sure, when in the regulations they'll also list safe harbors for anti-kickback, which means if you fall into this area over here, that's a safe place for you. It's a safe harbor. So you will not be, coming up against the anti-kickback statutes if you're falling under a safe harbor. So they'll also kind of look to see if whatever question you're asking falls under the safe harbor, so they can say, hey, we're going to give you a favorable opinion because it's in the safe harbor. So they'll look at that. They also look at the civil monetary penalty and the criminal penalty stuff. So when you get the opinion, they do actually look at everything pretty thoroughly for it, which is good since you're, again, having to pay for it. I would expect that they would really put it through all of that stuff.
Exactly.
So how, as far as requesting the advisory opinion, what process do practices go through? Because there's information about that, right? So if you think you want the OIG's official opinion on something that might fly in those regulations we were talking about, what do they have to go about and do to check that out with the OIG?
Yeah, so they literally need to ask, right? They put in they have a template of a form that you could use to, make the sort of official application process, right? That you have your list of questions, whatever you want to talk about, right? They also have certain things that they don't want you to talk about. It's not appropriate for an advisory opinion, like a maybe situation. This is kind of a hypothetical situation, something that's more of a model arrangement, things where they want you, where you're trying to ask a general question, right? And a general advisory. They want you to really be specific for things like that they will address. They're not going to be expecting you to talk about the fair market value of goods, services, or property in these advisory opinions. So, you really need to spend the time to go through kind of what the criteria is for what their advisory opinion process is all about, what you can submit. So not everybody needs to get one. It's completely voluntary, right? So if you do decide that you would like one, you absolutely can, but it is not something that is mandatory for all practices, for all hospitals, et cetera. And then, like we were talking about before, it is something that is going to have a cost, right, Betty? There is a typical cost for starting up this process with the OIG. So I think that's something that you should put a spotlight on, the cost for practices.
And I like to, when the things that you were listing, Sonal, if you go onto the OIG's website under the advisory opinion stuff, it will tell you, like, this is what it's good for, this is what it's not good for. And I thought one of the funny things was it's not to ask questions about somebody else. So it's not like you can go on there and say, ooh, these guys are
right.
And I want to know if we can go bust them, so it's not for like dropping dime on somebody else. It's supposed to be something that your business, whoever the
Yes.
requestor is, that they are personally involved in doing, not for a different company and seeing if what
Right.
they're doing is okay.
Right.
So
It's not what Dr. Smith down the street is doing, right?
yes,
It's only about you. It's about your services, your potential services.
yes, yes.
Yeah.
Yeah. So I thought that was,
But that was funny.
was,
Yeah.
you know, there was, but yeah. So the cost was something too, like the first time I had come across the information when I started kind of going into the advisory opinions and using them to help my clients and things like that. You know, the cost can, depending on the size of your business, you know, can start to run up. They will give you an estimate if you ask, but usually they say that the cost will run anywhere between $5,000 to $8,000, but may exceed $10,000 or more. So it's not something that, you know, you just kind of willy-nilly want to say, oh, well, we'll just throw it out and ask the OIG for an advisory opinion on this. You know, it should be something that you've really thought out and that you have looked to maybe experts, and people are maybe of differing opinions, where you've got one
Mhm.
camp saying yes and one camp saying no. And, you know, so you're saying, okay, I need something definitive, because maybe this is going to be a big part of our line of business. And, you know, if we are doing this and it's like half our revenue, and then come to find out that, ooh, you know, we shouldn't have done that, you know, it's going to be a big problem. You know, it's not for something that, oh, yeah, I think we'll, you know, we'll do this maybe once or twice a year, or this is something that we're, you know, so you need to make sure that it's going to be worth that investment. And from looking at the advisory opinions, and you look at some of the things that are there, definitely, you know, some of these, it's like their whole business. That's all they do. So they need to get that official opinion that, yes, it's favorable, you're okay. And we would not come after you, you know, and look at you for doing this. So it can get pretty pricey. So make sure that you need to get that opinion when you put it out there.
Exactly. You know, because larger organizations have, you know, in-house legal counsel, right? And so you and I know healthcare attorneys, plenty of them. There's a lot of minutia that goes into these healthcare laws and regulations, right? There's a lot of fine print that goes into these multiple safe harbors, right? And so if you have various attorneys on your team who kind of see a safe harbor this way, and yes, you can be protected, but your other attorney is saying, well, no, there's a little wiggle room there for you to not squarely meet the safe harbor, right? So when you have service lines like that, or things that you're trying to do that are very complex and complicated, and there is a difference of opinion within your own team, you know, for how to squarely, safely meet each and every safe harbor, that would be a great time for you to put the investment in, right, to get this OIG advisory opinion started up. I would think that would be a great time to go ahead and proceed that one step further, escalate it to the OIG and hear what they have to say. Because your own internal advisors are kind of at a crossroads.
Yeah.
Um,
It kind of reminds me, and I didn't mean to, but it kind of reminds me what that saying that we hear about, if you give an op report to four different coders, you know, they could come up with
oh,
four
yes,
different things. You know, it's the same kind of thing
absolutely.
with these regulations. You know,
Yes,
you have attorneys that sub specialize and only look at,
right.
and some of them will be like, well, I could defend that. But
Yeah,
so it depends on, and others that would say, yeah, maybe, but is it worth it? And is it,
right,
so
right,
you're spot on with that and looking at it. So it from that company standpoint, you know, it's
mhm,
like what they are willing to. If you've
right,
got, I've been at places where the compliance officer was an attorney and was, well, I could defend that and I could defend that. And I was like, okay, well, but do you want to have to defend that?
right.
You know, that's kind of,
Yes,
but you will get some
Mhm,
attorneys
mhm.
because that's how the business runs. They're very
Right,
aggressive and they're very,
right.
so it's that same kind of issue. It's all of those things are not black and white. They're
Mhm.
there could be a word, like the shall or should words in
Right.
the book, right? That
That's right.
really changes what it means for
Mhm.
somebody. What if it says you shall do this or you should do that?
Right.
So it's that kind of thing that it, something that looks clear, it can get very muddied, and especially when, you're contemplating whether you could get in trouble for this
Mhm.
with the government,
Exactly.
and the safest way to get that answer is to do the advisory opinion, I would think, right?
I agree. I would think so as well, right? You and I have been doing this type of work for quite some time, and I agree with you. With the innovations in healthcare, right? There's so much new that's coming around from week to week, right? There are so many new devices, drugs that are coming on the market, types of surgeries, right? There's so much new that we're involved with from year to year. So, just based on the work that you and I do that's new from year to year, we definitely always ask around, right? Our attorneys, what do you suggest?
Yeah.
This is brand new. How many providers are doing this in the nation currently in January, right? This technology just came out last spring. So, how many doctors are actually utilizing it, et cetera, right? So, these are all types of things that our organizations have to really do their due diligence on, and start their service lines off on the right foot. Um, and if these are big ticket things, which we will disclose as the month goes on the various laundry list of things that are unfavorable, right? But again, we'll get into that as the episodes unfold. But that's the multifaceted complexity that the OIG is going through, right? Based on these various requestors' services, right? And what they're trying to do. And that's what they are good at doing, right? They
Yeah.
poke around and make sure that you're not going to be violating any of these fraud, waste, and abuse types of laws that exist, right? And they all kind of interrelate, et cetera. So that's what you're spending your money on when you get these OIG advisory opinions, right? It's an investment because they're really cross-checking that laundry list of 5 or 6 of the federal regs that are at risk of being violated.
Yeah.
So
And also they have a timeline when you send in a request. So they say that they
okay,
will give you a response within the 60 days from
great.
the time that
That's
you
great.
do your official request. And to your point too, Sonal, there was also, when we look at that, that they also use experts. So if there is a particular thing. I think the example that they gave was something about programming for something that was specifically in the request that someone was asking about. They would go out and get an expert that deals with programming and
That's
have them
wonderful.
take a look at things so that they understood what they were looking at better. So which also probably adds to that fee that they're
Right.
charging you. So they do use experts that are non-legal when needed, so that
Wonderful.
they have the
Wonderful.
complete information for themselves. And they will respond to you within 60 days when you get those out, which is why when we were looking on the site, you'll see that it's not like there's an advisory opinion once a month or once
Right.
a week or once every 2 weeks. We were recently, there were like 4 that were put on in
Mhm.
January. And I think one of them or 2 of them might be on our slate to discuss on future episodes. But then there were a couple in December. Now, the ones in January all dropped on the same day. So
Right.
the ones in December, there was one like on the 20th, then there was one on the 18th, and then so they were kind of smattered, and there were none in November. and then there were some more in October. So when you go out there, it's not like it's not like the CBRs where they put one a
Right.
month. So sometimes you'll go out there and there won't be anything new for a while because people have not requested it. But you can search. And so if you are doing, looking at something to do with a specific device, like maybe it's a Holter monitor, you can actually type in Holter monitor and it will show you if there's an advisory opinion about that. You can do it about what you're going to be doing, like a free piece of pie, you can put that in there, like a giveaway and see what they have on giveaways. You can either look by specific item or you can look by type of thing that you're looking to do, and look and see if they've given advisory opinions on it, because you might not find something that's specific to the exact thing you wanted to do or the exact line of service, but you can look and say, hey, this other company over here that sells something else wanted to do the exact same thing with their product.
Right.
And the OIG was like, we don't think so, so maybe you just saved yourself, a few pennies, right?
Exactly. Great pro tip, Betty. That is exactly what that search functionality is for, right? And I love that the OIG provides that. Their public website is really, really useful and friendly to the general public. You do not need to be a consultant. You don't need to be someone who really knows the ins and outs of what's going on. You can literally just be someone searching, right? So that's a great pro tip. They have a laundry list of advisory opinions from the past. So in my opinion, those are terrific tools for you to go and look at and read, right? Because there are many, many instances, like you stated, it's going to be the exact same thing that you're trying to do, but someone else already asked, right? Someone else has already asked and they just used their own product, their own service line, right? But it can be interchangeable if you spend the time doing that research. So that's a great pro tip, because there are plenty of advisory opinions out there, plenty. And you're also accurate in stating that these advisory opinions don't have like a schedule, right? They just get done when they're done, and then they post it, right? So it's not as scheduled as your example, the CBRs. Although do note, I posted this on LinkedIn, the CBR program is kind of shut down for a minute. They'll get back on in the fall of 2024. So I don't know what's going on there. They used to be like clockwork. Every month it was published, but now they're kind of on a pause. So we need to wait and see there. But anyway, I digress. So the OIG advisory opinion is a wonderful place where you can just type up and search for things like gift cards or neurology services or optometry, contact lenses. Like there's all sorts of things you can search, and you will find something. Consultants, you can find gift cards or gift baskets or co-pays. Like there's all sorts of things that you can search, specialties that you can search. So I think it's a great additional compliance tool that they provide, an educational opportunity for healthcare.
Yeah, those were great examples of things to look up too, Sonal. So we would say if you think that this is something that you should do, that your first step would be to go to the site and see if somebody else didn't do it first. So make sure that they haven't already answered the question, and then take the step, look at the application, look at the template, because they offer those. So once again, and we'll post these in the chats when this is going out live. But to request one or to submit for an advisory opinion, they have a specific place here, and then they also have that template that you can get to help fill out, because if you're like, well, I don't know how to ask, or I don't know what steps to do, so all of that stuff is available for you on the OIG site, which once again for advisory opinions is when you just go to the oig.hhs.gov site, you will see one of the tabs that will take you, if you click on it under compliance, to the advisory opinions, and it will take you there to where it lists all the stuff. And it goes in a little bit more detail of the stuff that Sonal and I have been talking about on this episode. So if you want to research all the stuff we said, you can go there and go through their frequently asked questions, or like FAQ section, and kind of take a look at it. So we will, for the compliance capers, for the episodes coming up in February, be taking a look at different advisory opinions, to look at some that were favorable and some that were unfavorable. So you can kind of see, how they put out the opinion, and again, watch for things that you may be doing in your practice or your business that might fly in the face of, the anti-kickback, or might be a safe harbor in the anti-kickback, whatever, that you can kind of check that out and see if there's anything in there that could be applicable and helpful for your practice.
Absolutely. I can't wait for the month of February to unfold. It's going to be a really exciting month of these various favorable. Always happy to talk about the good news, right? Yeah. But then we will, unfortunately and fortunately, be sharing some bad news as well, right? What the unfavorables are and why, right? Yeah. We'll try and dive a little bit deeper into the why and help you understand. Because again, we will disclose what the language is in the advisory opinion, right? So it's a lot of legalese, right? Because it's from the OIG. So the language in their response to you will be a little bit complicated, right? It's not as simple as just regular communication. It's much more legal speak that is in there. So we'll try and help get to the bottom of things and put our, hopefully, some easier language into the discussion for our audience. So I know I can't wait. I'm looking forward to it, my friend.
Good. Thank you. Well, thanks everybody for joining us today and listening in as we give the background on the OIG advisory opinions. And we look forward to seeing y'all on the next episode of Compliance Capers. So thank you, Sonal. I think this was a really good one to give everybody, a nice, good place to start with in what we're going to be diving into this month.
I love it, my friend. Thank you so much. This was a great session. Can't wait to see everybody again next week.
Thanks, y'all.
Thank you. Bye-bye.